My name is Carolyn and I'm 16 years old. Yeah, I do swimming. I made the varsity team this year. I've got 3 sisters, 1 older and 2 younger. Like, I try and be the peacemaker between everyone.
That's it?
Yeah.
Did it hurt?
Yeah. I was in 2nd grade, so I was 7 years old. I started getting really sick all the time. I think it was in the spring, and I was just like tired and upset all the time. I would go to my room and like cry for like 5 hours for no reason. Like, I was depressed, I was getting lazy, I didn't feel good, and my mom thought I had Lyme disease, so that's why she took me to the doctor in the first place. And then just like a routine thing, they check my blood sugar, like they prick your finger, and my blood sugar turned out to be like way higher than normal, like 300 something. So then they realized right away that I had diabetes. This is the cabinet where I keep everything diabetes related. There's a lot of stuff. It's like, these are glucose tablets. They're basically sugar. I take them when I'm low. These are all, in these boxes is all supplies like these that I use for my pump. This is just like a plain insulin syringe. This is what a bottle of insulin looks like. There's all kinds of books on diabetes and stuff. Alcohol swabs, lancets to prick my finger with. And then we've just got like stuff on the wall, like information about it, I guess. I didn't understand like why me, I guess, you know, like, I don't know, it just didn't make sense to me when I was that young. But I remember like we were in the hospital, it was like the 2nd night there or something, and a couple nurses came in to try and explain it to me, you know, because like I had this disease and they had to, you know, explain it to me. And I remember they were like showing me pictures of everything, you know, like, and this is what's wrong with you, blah, blah, blah. And like, I already understood what they were talking about because I used to read the Babysitter Club books all the time. You know, it's like a series, and my favorite girl in it was Stacy, and I wanted to be just like her. And one of the things she had was she had diabetes. And so like reading the books, I learned like all about it without even trying. And then I ended up getting diabetes, which is kind of really weirds me out. I have to test my blood sugar about 5 times a day, and I just take a little pricker and I prick my finger, and like a tiny drop of blood comes out, and you put it on like a test strip and it tells you what your blood sugar is so that you know if you're at a good level or not. And I do that when I wake up in the morning, at lunch, when I get home from school, at dinner, and before bed. So 5 times a day. And if I'm too high or too low, if I'm low, I'll eat something, like I'll have like juice or whatever to bring it back up. And if I'm too high, then I'll give myself insulin using my insulin pump to make me go back down again. 588, which is actually really dangerously high because I've been really high today. I'm not sure why. It just like happens sometimes. So it's been kind of a crappy day.
What happens when you're really high?
Usually I just start feeling really crappy. Like, I'll feel like I have a fever, and I'll get really tired and probably really irritated. Like, I'll be in a horrible mood. Sometimes I get really nauseous and I might throw up. And it's just a really bad feeling. Like, your head hurts, you get all hot and achy. It's just like being sick without being sick. When I get low, I get like really shaky. Like, most people know a little bit what it feels like after you haven't eaten for like a day or something, you just get like really shaky and you can't focus, and like, you know, you're so weak and everything. And it's like that, but a lot worse. And you literally feel like you can't like move. Bye-bye. My room's a big mess because everything that was in my closet is now out of my closet. So
It has to get worse before it gets better.
yeah. There was this one time I remember, I think we were on family vacation in Utah over the summer. That's where all our relatives live. And we were trying to figure out who was going to go on this hike with my parents, like, because they couldn't take all of the kids. So, you know, we were just trying to, like, see who could go. And I was like, oh, I want to go. Because, I don't know, I was like 9 years old, I think, and I really wanted to go. And I remember my older sister, Emily, was like, no, why would you go? That would take up so much of their time. They wouldn't even be able to enjoy the hike. And I don't know, I felt kind of bad about it because I knew she was right, but like I couldn't help it, so. Diabetes is really hard on like your hands and your feet and your eyes. Like if you get a cut on your hand or something or your foot, you have to take really good care of it because diabetics have less good circulation, so it could develop into an infection. And you know, like people have gotten like their feet amputated because they had like a little cut and they had diabetes. Yeah, my friends all know. There's usually a conversation that's like, what's that thing on you? And I'm like, oh, it's my insulin pump. And then we talk about it. And they know, like, if I'm low, like, they'll run and get a juice box or whatever. It's really good. Okay. And then I didn't have anything to eat. So I've got to take 18.7, which is a lot of insulin. And then it'll just start going, and the insulin gets pushed out of here really slowly, and it goes through this tube. And then my set is right here. I do it in my butt because it has the most fat on me, so it's the most comfy place. I try not to make like a big deal about it when I'm not feeling good because of diabetes, or like if I have to like test myself or whatever, because I don't want to like get in the way of things. So I try and not make it like a big deal, but sometimes you can't help feeling like a burden, like, you know, like everyone has to like stop what they're doing if we're all out together, if I have low blood sugar, because I can't like be walking around and stuff, and I always have to like carry things with me. And so yeah, I do a little bit, and I know my parents always have to worry about it. It's almost dinner time in the Todd house, which means I have to test my blood sugar. So I'm gonna go do that. Like it's not that big a deal to just like stick a needle in your arm or whatever, but like after a while you start to really resent it, like having to do it every day. And so yeah, it's hard.
Was it hard to learn at first? Were you scared to try?
Yeah, I remember the nurse who taught me all about it made me practice with a needle on an orange so I wouldn't mess it up on myself, which is a good idea, I guess. But it's weird, like, you know, if you think about it, how many 8-year-olds have to know how to give themselves shots, you know? It's a really strange thing because, like, you know it's a part of yourself and that it's always going to be a part of yourself, but you can't, like, you have to hate it because, you know, it's like it's something that just makes your life a lot harder, but you can't just forget about it and, like, not care about that part of yourself. Like, to be healthy, you have to care and you have to do those things. So you have to, yeah, you have to come to terms with it if you want to be healthy. And so people are working to find a cure, but it's kind of hard when people don't really think there is one, you know.
Do you think there is one?
I think there's a cure, yeah.